I have bone on bone knee arthritis. What's the first thing that I should do? I get this question just about daily. What's the first thing you should do if your bones are touching right here? Now, the number one thing, let me get right to it, is you need to control the pain. Get off your feet and rest your knee in a way that makes it calm down. You don't want to do anything that aggravates it. I am assuming that you're aggravated right now, because if you're looking for help right now, you're probably sitting right there with a red knee. It hurts, it's hot, it feels uncomfortable, you can't sleep at night potentially, and you've got to make sure that you get those symptoms under control. Because in the long term, to fix the long term problem, which is what my program is heavily about, you've got to be able to do some exercises that are going to put a lot of pressure through your knee, but you have to be ready to take it. And right now, you're probably not ready to take those exercises. So, goal number one, the first thing you should be doing is just taking pressure off your knee. An easy way to do that is by resting. But yeah, you shouldn't rest too much. Complete bed rest is not a good idea. You have to do relative rest. What I mean by that, get a cane. If you lean some of your weight through a cane, you're going to be offloading your painful knee, and that's going to extend the amount of time you can do things while allowing you to use your muscles. Another thing you need to do is calm down your quad muscles right here. The quad muscles are on the front of the thigh, and usually they're part of a massive muscle imbalance that's pulling everything up into the knee joints, causing that irritation. And if you can massage those muscles loose, use one of those massage guns along the thigh muscle, that's going to allow your knee to feel tremendously better right away. It's not going to last long. You have to get it to stay calm for a while, but it's going to set you up to do those exercises later on. And then the last thing you need to do is figure out how to start activating the right muscles. When there's knee arthritis, usually you have that imbalance, and when the quads are too active, it means that the glutes in the back of the hip, the butt muscles, are usually not very active. And the way that you can tell this on yourself, right now, whatever position you are, if you're sitting, standing, lying down, think about squeezing your butt muscles, making those butt muscles tight. Try to activate them and hold it. Go as hard as you can, as long as it's not hurting anything. After about 10 seconds of holding it, you should only feel your glutes working. But if you feel your thighs also working, especially your quads in the front of your thighs, that means you likely have that muscle imbalance. And what's happening is every time you go to do a movement where you should be using your glutes, your body's rewired itself to where it's compensating and using your quads, and that excessive use of the quads because of compensation, because of weak glutes, it's making you over pressurize your knee joint, and that's what's setting you up for this arthritis problem. So a foundational thing that you've got to do is begin to get the glutes to become active so that you can set the stage to get those quads to calm down. And then as you get into later phases of knee arthritis recovery, you should be able to strengthen the glutes well without aggravating your knees. Now, this process typically takes anywhere from 1 to 4 weeks to get the knee pain to calm down, the swelling under control. But for some, it might take longer. And I always get asked, well, how long? But it just depends on you. It depends on how severe you are. It depends on how long this has been going on. So if you've had arthritic knees for months now, if it's a chronic problem, then it takes as long as it takes. 1 to 4 weeks might not be enough. If you've had intermittent flare-ups, like every few months or so many times a year, and this has been going on for years, it could take you a while. It just depends on the individual. But on average, I see people take anywhere from 1 to 4 weeks, less than a month, to flare down. Doesn't mean that their knee arthritis is gone. It just means that they feel like they can do more stuff now, but they still have a limit. They feel, people at that point will feel, well, I'll overdo it if I go walking too long at the grocery store. I'll overdo it if I pick up something awkwardly or too heavy. I'll overdo it if I sit in a certain position or bend my knee a certain way. It'll hurt my knee. They'll have that feeling still. That means that you're ready to start doing some of the corrective exercises for the glutes back here so that you can get some long-term benefits and fix this problem for the long term. Especially if you've been told that you have bone-on-bone knee arthritis, you're probably going to have a flare-up. So think about this. If you're all flared up and you go through some rest, you get the massage going on your thigh bone, you get the glutes to work, you get on the cane, and you actually do calm down your knee pain. Because a doctor might have told you that your knee is bone on bone, people start getting it in their head that as soon as it flares back up, that's the last straw. Let's go get this operated. Let's go get the replacement done so that I'm not having to deal with this because there's no cartilage left. When people say bone on bone, the assumption is that all the cartilage on the end of this bone is gone. But in reality, if you can bend your knee about 90% or better than the other knee, what's probably happened is you have a dot about that big on the bone, on the cartilage, that where it's worn down, maybe gone, but you still have all this other cartilage all around. And on the x-ray, where they'll show you the view from this point, I can't do it on this skeleton, but they'll show how the bones are touching, and that's where the doctor will say, look, the bones are touching, that's not normal. You should have space where there's cartilage. Therefore, your knee joint is bone on bone, and you have bone on bone arthritis. And they're talking about that spot. What they're not telling you, because they don't know, it's not their training, it's not their fault. They just didn't go to school for this stuff. I did. But that's why you're here. Your quad muscles are pulling because you have those weak glutes. Especially if you're in your 70s. For some people, even in their 60s, you lose your butt muscles. And you didn't do this on purpose. It's just that you've developed these compensations where you don't use your butt and your quads take over. And so your quads are just yanking everything up and smashing that poor spot. But if you can unsmash it, if you can get the glutes to work right and get those quads to relax, that'll take pressure off the joint and allow you to disperse, to distribute the pressure more evenly throughout the knee joint. And I can't tell you how many people I've walked through this process, no pun intended, and they have gotten better, even though they have that spot right there. And the surgeon doesn't really know, unless a surgeon goes in there with a scope, a tool that has a camera on the end of it, and they can see the bone and how much cartilage is actually gone, they're guessing. And they really don't know how much cartilage is gone. And they won't tell you that. They just say bone on bone, worn down cartilage, and that's it. Although they'll even say your cartilage is gone and never explain that you still have a bunch of cartilage everywhere else. There's just a spot. You can live with that. Don't you have scars in your body that you live with? Same thing here. And yeah, it's a weight-bearing joint, but if you distribute the weight properly, you'll unweight the spot and you can get by just fine. I have people that do it all the time. So that's the first thing you need to be worried about. I would add this on, don't freak out. If you have bone-on-bone knee arthritis, one of the first things you should do is not freak out, not get overly concerned. Make sure you unload this joint, get the quads to relax, train those glutes, get them to become active, and don't worry too much. If you have good motion in your knee, even if it makes noises when you bend your knee, you're gonna be okay, and you can recover from this knee arthritis flare-up that you're going through. Okay, I wanna tell you about our knee arthritis recovery program. This program is specifically for people that have knee arthritis, whether you've been formally diagnosed, you've had an x-ray or an MRI and the doctor told you that you have knee arthritis, or you suspect you have it, and it doesn't matter how severe it is, if you've had it just mild, grade 1, some doctors will tell you, or if it's more on the severe end. If you have tried exercises and advice and tips that I've given you through our videos here, then chances are you have benefited from it because this stuff works. Chances are even better that you're going to get tremendous improvements if you join this program. And let me just tell you how it is real quick, how the program's set up. It's a membership program. There's different tiers of this. On the first tier, it's group coaching, along with the whole curriculum of 40 plus. I think it's approaching 50 videos now showing you how to do it. So you can just go through the program, watch the videos, and have massive improvements. But you also get access to group coaching where I'm on the call with you, me and my coaches, and you get to ask us questions so that you don't get stuck through this program. And then you also have the option to get our higher tier, which is one-to-one coaching with our recovery coaches, but you still get the group coaching too, and of course you get the whole curriculum as part of that package. So go check out the link nearby here to learn more about the knee arthritis recovery program, and I hope to see you in the program on our coaching calls.